I'm Benedict. I'm a patient here at Hillingdon, and I've come down to Peter Pan ward with Arzu to check out what they're doing to make medicine safer for patients like us.
The doctors and nurses have been working to improve the safety of our medications here on Peter Pan ward and also in the neonatal unit and in A&E.
We've noticed through our governance meetings that medication errors have played probably the largest part of the clinical incidents that occur for our department. And then it was one particular drug error with one particular child that led us all as a department to think that something really needed to be done. And so as part of that, Dr. Bate and myself decided to lead a project to try and improve medication safety in the department. And we then got a multidisciplinary team involved, so nursing staff from both the paediatric and neonatal unit and paediatric emergency department, as well as junior doctors from the different departments, all came together to come up with ideas as to how we could improve medication safety.
I've started seeing nurses wearing red outfits when giving me my medication. This is a sign of other staff and patients not to distract them while getting my treatment ready.
As a busy unit, we're dealing with children with complex needs and highly toxic drugs such as chemotherapy. We need to really concentrate because obviously this has a profound effect on the children. If we're interrupted, then obviously we can be given the wrong drugs.
If you put a window in the middle of this door, how does that help?
Sometimes the simple things are the most effective, and the nursing staff from Peter Pan ward have been saying to us for some time they're constantly getting interrupted because their colleagues don't know that they're checking medications because the door wasn't obviously see-through. So as part of this stamp project we arranged for the door to be changed to one that had a window so people can now see if they're checking medications and not disturb them until they've finished.
Our doctors and nurses here are now having a safety huddle on their ward round, which is basically a half-time tea talk.
The safety huddle is essentially a brief chat with multidisciplinary team members where all of the team members feel empowered to talk through various issues for each patient on the ward. And the key issues that are identified really are to look for children who are really sick or deteriorating, and children who are on unusual or complex medications, which relates to our medication safety project, and that's amongst other things. So by having that team huddle in the morning before starting the ward round, the whole team, so the consultant, the junior doctors, the nursing staff, everybody's aware of any child on the ward who's got potential issues with unusual or complex medication.
Every weekday, a pharmacist goes around with an iPad and records how well the team are prescribing our medicines. The team get given marks out of 10 and at the end of the week, each week, depending on how well they've done.
On the neonatal unit and on Peter Pan wards, I am screening the drug checks as usual, and I am counting the new prescriptions that I see, and if there's any errors or anything that needs clarifying, I'm taking a picture of the prescription so they can be fed back to the prescriber.
As a patient, it's good to hear that nurses, doctors and pharmacists are all working together to make our medicines even safer at Hillingdon Hospital.
Thanks for watching our video about safer medication for kids here at Hillingdon Hospital. I'll definitely be looking out for all these improvements next time I'm here.